Attention, please. The show starts in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, go.
Smelly cat, what are they feeding you? Everybody! Smelly cat, it's not your fault.
Brothers and sisters in Islam, if the sun
Let's go. Happy New Year. Happy New Year. Welcome, welcome, welcome. Mrs.SheSaid is in the building. How y'all doing out there? Shame Sunday. You know, with shame, we got to bring some knowledge, right? So today we will be discussing vaginal hygiene and the reproductive system and the care thereof. Some information and knowledge that our elder women neglected to give us, sadly. Maybe they were ashamed to discuss issues, problems, concerns, just the basics, making us aware what was happening to our bodies. So this is more of an informative show today. So take a moment and, share with any young ladies or women that you would think who would, like to build on this. Because a lot of us were neglected as young girls, misinformed. We got a lot of our information from the street, trial and error. So let's do it. Let's change that dynamic and do more sharing with our young girls as they're growing up. Young women, be available. Be intentional, answer the questions, because there's a lot of things that go on with us as women, as females, born with reproductive systems, and it's not taught. It's really not taught. I want to give a shout out to everybody popping in. So I hope y'all took a moment and shared. It's going to be a good one. Either Man Williams is in the building. How you doing, sir? I appreciate you pulling up and popping in. My girl, Queen Karma Corleone is in the building. Karma, hashtag shame in there so you Nightbot can drop your channel in there so we can all support you, sister, because this girl, his music is lyrically positive. And we need more people like her to be promoted. So let's do that. JP, the aspiring matriarch, is in the building. How you doing, sister? It's a topic that is near and dear to many of us. Our reproductive systems are very important. And when we don't have the knowledge and the information, we're not safe out here. So it's kind of on the women who are older than us to share these things. Mr. He Said is in the building. How you doing, sir? I love you. You are appreciated. Ooh, get the tingles. Yeah, it's been something. 2022 was, sometimes it was a little shocking, to hear some of the, experiences of others, when you come to unsanitary vaginas. It's unique. And if you're not aware and someone tells you, you blow up. So, we can smell you. We can smell it. And it may be some concerns. So we're going to share today. And gentlemen, this is information for you as well, because I'm not sure you weren't given a lot of information about women and how things work. Most people in America get a sex education class in like 7th grade. As many years before that, they learned so much misinformation to have them go in there and have one class that's really not giving them much of anything. So it's kind of on us to be their teachers, be their mentors, and, give them the information that they need. And if we don't have it, it's kind of hard for us to give it, so I'm just one of these people that have always reflected. So as a young girl, if I didn't get, the information that I needed, we sought it out. We sought it out. So now that I'm an elder and, I'm raising 3 females, it was very abundantly clear to me that from the beginning, it was information that I wanted to give them. And the first one was them to not have any shame about their body. And by that, I mean, never making up names for their body parts or boys' body parts, for them to think that I'm afraid to talk about it or uncomfortable. It's always something I tried to promote, just coming around friends and, other people who raise children, and they make up names, your poo-poo, your twat, your flowers, for the breast or whatever the case may be, and it's a lot of misinformation. We kind of create the delusion, and then we're a little afraid or, taken aback when we're asked these questions and we don't know. So instead of saying we don't know, we give them misinformation or no information at all, or make them so uncomfortable that they can't come and ask and discuss what's happening to their body. And a lot of us women don't pay attention to our own bodies. So we don't know. So it's hard for us to try to, give examples or explain things to them when we haven't self-reflected on our own bodies. This is your vessel, and you guard it, you nourish it, and it's on you. So it's nobody's fault. So now it's our time and our turn to change the dynamic of that, be more comfortable with having these conversations, even with our mates, because it could be something that's going on. You need to have the information. So I got some videos, got some clips. I got a lot of information. So you guys are ready? You got a little icebreaker or something? Because it's all out there for y'all to see on social media. People discussing and talking about, not being cleanly. Little kids are the most honest, which we adore. And we teach them how to lie by being upset when they're honest. Okay. So let's do this. Let's do this icebreaker.
Vagina is not a sterile environment. It's full of bacteria in there, and the vagina does have a smell to it sometimes, and it often changes with your cycle. It can change if there's a flora shift. So the vagina has good bacteria inside that keeps everything in check, and the vagina is more of an acidic environment. But sometimes if the flora shifts for one reason or another, whether it's from using a soap, intercourse, or a condom, or some sort of chemical down there, or a lubricant, it can sometimes shift. And when that flora shifts, it can sometimes change the odor, and that sometimes could cause an infection. Bacterial vaginosis is for sure a very common vaginal infection that tends to give off sometimes a strong fishy smell, even sometimes a chemically smell, and that can definitely be treated with a medication. But we have to remember that the vagina does have good bacteria in there, so it does have different odors to it. Also, when you get your period, blood has a different smell to it too. So when you have your period, it may smell differently. So the vagina does have a smell. It's supposed to have a smell. If it smells really foul or rancid or like a really, really strong odor, sometimes that could be because you forgot something up in there. Forgotten tampons can cause a really nasty smell. So if it really is smelling bad, I would say get it checked out. But like a sweet smell or even sometimes a tangy smell or a coppery smell, like smells are normal. Our vaginas are, they have bacteria, so sometimes there's smell. There's also sweat glands down there. Sweat can smell too. So if like you're wearing leggings and you just worked out and like you go to the bathroom and you smell a little sweaty, like that's normal. I think there are so many products out there on the market for surrounding like keeping vaginas clean and keeping them fresh smelling. And I really feel like we need to like stop that nonsense. Your vagina cleans itself. Warm water only, maybe a really good probiotic if you want to keep good vaginal flora, and that's it.
If you need to hear that again, when the show is done, you can always watch it again. She gave some good information. Many of us are not aware that the vagina cleans itself. Us young girls, we get in the shower, remember getting that burn, like, oh no. And that's when you get the information of don't put soap in your vagina. So, that's the first lack of information that's given. I think us women need to take a little more time and model that. So with your young girls, as they're getting older, have them in the shower with you. Show them how to open up their vagina and rinse it out properly. So just getting us a little more comfortable with that. JP chimed in. She said, Mr. He said, a woman and her circle should know she smells, and before a man does. We have 50% more olfactory senses. We have to stop teaching to cover it up with perfumes and, scents and, all types of things. All the chemicals that they put in these products over the counter are not good for you. They can actually cause you to have imbalance of your pH, UTIs, so be mindful and be careful to not get these products inside of your vagina. It's amazing, how we want to be parents so bad. And then as they're growing up, we neglect to educate ourselves in order to educate them. Because the statistics of failure of reproductive systems nowadays is very high. Very, very high, and we all should be very concerned. And like she said, what we need to do is eat properly. The things that we ingest and digest affect us, especially our reproductive systems. Obesity affects us, especially our reproductive systems. The chemicals that we put in our bodies, alcohol, smoking, any types of drugs, birth control, all these things affect us. And there is no guarantee. There's no guarantee that you are going to be able to successfully reproduce. No one tells us to get tested, how to test our fertility early, so we can make these hard decisions to choose to wait or not. So we're going to discuss a lot of these topics today, and I appreciate y'all stopping in and popping in. Again, share, because us women need to start sharing with one another, because the information is needed. We're all different. Vaginas are different, and we need to tend to them appropriately and be intentional and proactive, because we wait until things are really, really wrong and we find out it's really bad. Many women who do find out that they are in ovarian failure, have ovarian cancer, they're usually in stage 4, because we ignore a lot of the signs, a lot of the pains, the aches, the changes in our body. And maybe a little embarrassed to be in the doctor and say all of these things, so you have to be honest so they can make a proper diagnosis. Because some things are unseen and can't be seen through a sonogram, through blood tests. There's no way unless you're going with a camera to look, and that's called endometriosis. And we're going to discuss a lot of these things today. So sit tight, and I think I'm going to get started on my first video, because knowledge is needed. And if anybody has any questions, anybody want to join and discuss, feel free. It's all about trial and error. And we don't want our young girls to continue this cycle of getting themselves in positions that may damage their reproductive systems. The first video I got, I'm going to discuss properly how to clean your vagina.
Also known as Dr. Rejuvenation. Today we're going to be answering the question, how do I keep my vagina nice and fresh and clean? This is a pretty simple, straightforward answer. When you shower, like say shower with some mild soap, let the soap run down your body. You can kind of pat the area down below. I don't recommend even scrubbing, because sometimes it can cause irritation. I don't recommend using any kind of scented bubble baths or fragrances or scented oils, because that can irritate the skin down below. If you're gonna wear tampons, don't wear tampons for a prolonged period of time, because you can also cause some bacteria growth, which sometimes, believe it or not, can also be deadly. So don't wear tampons for longer than prescribed. Secondly, if you are going to wear underwear, I recommend wearing 100% cotton underwear. Or at least if you're not, then have it lined on the inside with 100% cotton underwear. Why? Because other materials like Lycra, for example, can actually trap moisture and trap heat, which is a breeding ground for bacteria and can lead to yeast infections or other bacterial vaginal infections. If you work out and your underwear gets really damp, I say change into some dry underwear afterwards, again, to avoid trapping moisture and heat. So I hope that helps.
I agree. I hope that helps a little. Cotton panties are best. And I would also add, nighttime sleeping without underwear. It's great. Gives your vagina some air. It's a lot of points that my mom did give me. And there was a lot of things that I didn't get. She was always very open. So I was always able to come ask the questions. I guess I just didn't. And being a little latchkey kid, being outside, getting all the information from friends, and, it was a lot of misinformation there. So the misusing of tampons, I absolutely did as a young girl. And I may be suffering, now because of that. And other mishandlings of myself. So I'm not here just to, point the finger at anybody, because we all have gone through not having the information. So this is why I feel so passionate about giving this information. Again, I am raising 3 females, so the information has been quite on a daily basis. I'm very open and blunt. They can come and ask me anything. So now we have the youngest one, and we're coming into really giving her the information. I put this together as well, for her, and she's 8. Because young African-American girls can begin their menstrual cycles as early as 8. So we need to be aware, and they need to be aware, because imagine the fear and the scaredness that they feel once it happens. I remember when I was 13, and I was still afraid and shocked and like what to do, you know? So to not have someone to get that information from before it happens, you know, I think it affects us, and we don't even realize psychologically that it affects us. You know, I absolutely didn't like myself because of it. I didn't like it. So we have to say that causes some type of psychological effect. Growing up as a young girl, your body is changing. You're not aware of it. It's scary. It's confusing, and embarrassing, to say the least. So you're not going to share as much. And for young girls to have their period as long as 9 days, 10 days. So it's things like that we need to pay attention to early, because something's going on. Our bodies are not meant to menstruate that long. You know, there was a time 3-4 days should be the longest. So any of us who are menstruating really long, there's some cause for concern. That is a cause for concern. If you change your diet, exercise, reduce stress, all of those things has a lot to do with it as well. So when we carry all these things and we're not nourishing our body and giving it plenty of water, it affects your reproductive system. When you're in the womb of your mother, those eggs are set. You have a set amount. Either they're fertile or they are not. And if they are, you have to keep them healthy by feeding your body healthy things. So all the processed food, all the sugar, it's not good for us. It's not. So we all need to make some changes, to protect us and to get our children's minds properly set to nourish it the way it should be, so they can have better outcomes later. Because I don't think they were really considering that. You know, young girls think they can choose any time to choose to have children. And, if it doesn't happen, imagine the turmoil. So they have to understand the reality and the science behind how everything works, how individually their body works. And just because your mother had 10 children back to back, that doesn't mean that you will be capable of doing the same thing. Times are different. We eat differently, and we abuse the hell out of our bodies. So mothers, let's start teaching our young girls to not abuse their bodies, and especially allowing multiple men to enter them. So it's something that should be preached and promoted, that they need to honor their self, their bodies, and their reproductive system. It's not all about, exploiting all your sexual desires and such, because you can harm yourself. You can do a lot of damage to your body. So, teaching them that as well is very important. They need to have all of the information so they can make the best choices for their body. But they're not, because they don't have all the information. Our society is not looking good. And now in a lot of places, women can't delete unborn babies. So they need all the information they possibly can get to make the best decisions. I got another video. We're going to talk about the differences in discharge. Oh, matter of fact, I think number 2, we're going into just reproduction. So if you have young people, this is information. I try to not be potty mouth. So it's something that you guys may be able to sit down and discuss with them as well. So the next video is going to discuss ovulation, so how it happens. Let's go. We'll get to pulling it up for you guys. Fertilization, we got all of that. It's important. Having one class in middle school is not enough. I appreciate y'all. Let's do it.
The reproductive cycle begins with ovulation, the release of a ripe egg or ovum from the ovary. Hundreds of thousands of follicles sit nestled inside the ovary. Each follicle is a sphere of cells with an immature egg at its center. The typical 28-day menstrual cycle begins on the first day of menstrual bleeding. During the first 7 days of the cycle, a few follicles start to grow. These maturing follicles secrete estrogen hormone into the bloodstream to prepare the lining of the uterus for pregnancy. Around day 7, all of the follicles stop growing and begin to degenerate, except for one. This dominant follicle continues to grow, nourishing the developing egg inside it. Around day 12, the follicle secretes a surge of estrogen into the bloodstream. When the estrogen reaches the hypothalamus and the pituitary gland in the brain, the anterior or front part of the pituitary gland floods the bloodstream with luteinizing hormone. Around day 14, luteinizing hormone causes the follicle to undergo a sudden growth spurt. Right before ovulation, the egg detaches from the inside of the follicle. The bulging follicle releases chemicals, signaling one of the two fallopian tubes to move in closer and envelop the follicle. The follicle swells until it bursts open, ejecting the ovum and fluid from the follicle into the abdominal cavity. In response, the fimbriae, tiny finger-like projections at the end of the fallopian tube, sweep across the ovulation site and pick up the ovum. Microscopic cilia on the fimbrial surface guide the ovum to the entrance of the fallopian tube. Muscular contractions along the wall of the fallopian tube gently propel the ovum toward the uterus. The ovum lives for 12 to 24 hours, the interval where fertilization can occur. If not fertilized, the ovum will disintegrate and be shed along with the uterine lining during menstruation, marking the end of one reproductive cycle and the beginning of another.
That is ovulation. Give a shout out to nature. Bodies are amazing. Amazing. Everything works together. If one thing is off, it can change everything. You see the work that your body has to do just to ovulate? Many of us didn't even know that fallopian tubes and ovaries are not connected. Because when they show us images, it looks like it's connected. It's not connected. Your tubes have to find their way to that egg and transport it. It's amazing. Yes, sis, we are all beautifully created. And I think just, giving us this type of information in this manner is uplifting. We are amazing creatures to be able to do that and cultivate life in our wombs. Like, it's a precious thing. And we really need to teach that to them very young. We try to negate discussing sex and anything under and over the moon about it. And I really believe it's because of our own shame of our foolish, bad, stupid decisions and choices that we made as younger people when we were coming up. And again, it was a lot of misinformation given to us. So we went out there and acted a fool too. Trial and error. Error. And it creeps up on you as you get older. We want to change that. We want our young girls to know the amazing creatures that they are in another way instead of dropping it like it's hot and giving their honorable, most precious possession to any and everybody and being proud of it. Because it may come a time later that you want to change your life around and it becomes difficult. Your mind is ready, but your body will always remember what you did to it. And it's going to respond accordingly. That was such a beautiful, beautiful interpretation of what ovulation is. And I'm one of them young girls where I didn't have hard menstrual cramps and such. But when I ovulated, it was the most painful thing. 2-3 days of a lot of pain. And it took years for me to get the answers of why. Like, when I'm at these doctors, no one said, well, when you're ovulating, things are contracting in there. So it's like small contractions, but they were so hard versus during menstrual, I didn't have any cramps, but long extended menstruals. So these kind of discussions when we're sitting around as young women, with our young girls around, these kind of discussions should be had. We should be talking about this with them, in groups, so they're comfortable to ask these questions, because we're all different and they're going to be different from you. And they need to be aware. The more awareness they have, the better decisions and choices they'll make. And we all know this. Reading is fundamental. Knowledge is power. Power is freedom. And we got to get there. The next video will be fertilization. So we get to see how that happens. If you guys are ready for that. It's another beautiful, beautiful, beautiful thing. Let's get this baby making. This is how babies are made. Quite simple, right? But quite effective. Don't allow your egg to be fertilized by just any seed. Know what you're doing genetically. It's kind of hard to know that if we're pregnant after 2-3 months of knowing someone. 6 months, 9 months. Get to know what's going on with that person. That is a precious, precious gift. And you don't just allow anybody to fertilize your eggs. It's a lifetime commitment with someone. And you should at least know that their DNA is agreeable with yours. And that you're going to be able to cooperate and communicate for the longevity of this seed. Because they grow up and they grow up quickly. That was fertilization. If you didn't know, now you know. The next video is something that, a lot of us really were confused as young girls because, discharge is different. Looks different, different colors, different smells. And if you're aware of the differences, it may help you decide what to do to change it. Something as simple as balancing your pH balance. Stop using certain products. Make sure you switch your washcloth every other day if possible. There's so many different things. So we're going to go into this video because a lot of us are misinformed about the different variations of discharge that secretes out of the vagina. So we're going to have a little intricate look into this. Get a little explaining going on.
Vaginal discharge is something that many people experience every single day. And typically, it's something that's often ignored and just not talked about. But that doesn't mean you're not curious. And the truth of the matter is, from the color to the scent, vaginal discharge can actually tell you a lot about your health. Let's break it down. Vaginal discharge serves many purposes to keep your vagina in proper working order. Vaginal discharge is a clear or whitish fluid that's made in the uterus, cervix, or vagina. The discharge naturally helps to keep the area clean by removing dead skin cells from the lining of the vagina. But did you know there's a range of consistencies and colors that's considered healthy, and some that could merit a trip to your gynecologist? Vaginal discharge can also change depending on where you are in your menstrual cycle, like before or after your period or during ovulation. So, here are some things to pay attention to that may indicate an issue requiring a visit to your doctor. If you experience white discharge that is thick like cottage cheese, along with itching and a burning feeling when you urinate, that could indicate you have a yeast infection. Fun fact: people who are prone to yeast infections could benefit from cutting back on eating foods high in sugar. That's because foods high in sugar can actually change the chemical balance in your vagina, allowing for an overproduction of yeast to form. Next, if you see an off-white or grayish discharge, that could indicate you have a common infection called bacterial vaginosis. This common vaginal infection happens when normal bacteria that lives in the vagina overgrows, causing a bacterial imbalance. This infection not only causes an increase in vaginal discharge, but the infection can also cause a fishy odor. Next, a greenish yellow or gray discharge may indicate a sexually transmitted infection called trichomoniasis, which may also cause an unusual fishy scent down there that you don't want to ignore. So be sure to contact your doctor to investigate more. The overall truth of the matter is, discharge can vary from woman to woman. It can even change throughout different stages of your life. That's why it's essential to always pay attention to your own body. And just remember, you are your body's best advocate. So if something doesn't look right or smell right, the best thing you can do is talk with your doctor.
Sounds nice. Check one. Yeah, get emotional when we talking about vaginal discharge. Pay attention. Pay attention to your body. Rewind that if you need to watch it again. Very important information. I see y'all laughing in the chat. Don't be laughing at people who constantly have yeast infections. You know, it's something you're doing, something you're putting on your body. So pay attention. You got 50 shades of gray equal fish. Stop throwing your vagina out there to anybody, okay? Be cautious. We're going to have a little fun for a second before I move on to the next knowledgeable information. And let me just say, because I know it's a lot of gentlemen who are raising daughters too. So this is some, sit down with them, be able to be comfortable to answer those questions as well. Hopefully you have a, female inspiration around that can, offer some assistance. That would be great. Shout out to you ladies. But you guys out there raising them alone as well. So this is information for you too. So you can always look back and reflect. If they get to an age where you need me, the video is here for you, to help you guide them through those, tough questions. And it's good for you gentlemen to be informed too. So this is some information for you as well. If you did not know, now you know. I appreciate your time and consideration for popping in. We're going to get to some funny. Some else. We're going to break the monotony just a little bit. So if there's any children in, you can send them out for a second. Still a little funny. Might be some cussing maybe. Try to abstain from it today. A shout out to Shame Sunday and anybody popping in, share, because we females need to get a little bit more informed about our vaginas and our reproductive systems and take heed when you get some constructive criticism about you not smelling good. I'm just saying.
Push the button.
Yeah, come on, push the button.
Blow everybody up.
Yeah, blow everybody up.
Push the goddamn button.
Push the goddamn button.
Oh shit, shake that ass mama.
Down.
All right, let's do this.
You better not break my neck.
If it breaks, then you're a weak motherfucker.
Nah, she just
Kick
knew
my
what she was
ass up.
doing. You're the one that's weak if you can't flip yourself.
You help
up this way.
me, okay?
It's your
That's what we do. We're a team.
Yeah.
Help me.
I don't
Right,
know.
here we
Big
go.
ass forehead.
Here we
Let's see
go.
if you can flip. Come on, go. Damn, you stink. You forgot the douche.
I pissed my pants. I pissed again. Motherfucker. Fuck these challenges.
You cannot be asking your man to do some challenge that asks for you to put your vagina in their face and it's not fresh. You gotta be kidding me. Come on, ladies. You can't just be sitting around the house with funky vagina. It's not fair. It's unattractive. It's not ladylike. Something may be going on. And I'm sure the men don't like it. You can't be mad when they say something. I'm sorry. So good luck. Check yourself before you wreck yourself when you're doing these challenges. Make sure you're fresh, because I know the embarrassment has to be something unique. Oh man, that was something. Thanks, Hubs. Bobby had to find some stuff for me. I appreciate it. Let's get one more though.
And she stinks.
What's up? What's up?
You're excited
Excited about what?
to go to that party tonight?
Party tonight.
Yeah.
You think I'm finna go somewhere with you?
What do you mean?
You need to go take a shower
What do you mean?
before I go
take a
anywhere
shower?
with you.
I know
You
you're
s-
not trying to. I know you're not trying to play me.
No,
right now.
shorty, you.
I know you are not trying to play me right now.
No, shorty, you stink.
Don't play
like,
me. No.
like
No.
step back, bro. Like,
No. You step back.
like step away from me,
No.
bro. Like you stink, bro.
You
Like,
got the Rona. You got fucking problems smelling. Open your fucking nose up. Want me to go get you a nose strip, motherfucker? I don't fucking stink. Smell again.
man, move, bro. You stink, bro.
You
Move,
know,
go take
you
a
know
shower.
what? How about we smell you? How about we fucking smell
Smell
you?
me for what? What you need me to say?
Maybe you're smelling your
You
upper
stink.
lip.
Smelly cat. Ooh, chat.
Cat, smelly cat, what are they feeding you? Everybody! Smelly cat, it's not your fault.
It's your fault. Ladies, when you hear it from your man, I mean, I don't know what to say. Stop being so damn it's hard. I see it. You ladies, it's hard for you guys to accept some constructive criticism. But if you smell, you smell. That's amazing. It's always like, I know you not trying to play me. You playing yourself. You playing yourself by being up in somebody's essence in their circle, and they can smell you through your clothes. That's not okay. So I don't know who you learned this from. They taught you wrong. Even if you're not doing it for somebody else, it's not okay to just be rancid and funky, especially in your vaginal area. It's dangerous. It's unhealthy. The bacteria buildup is incredible, and constant bacterial, vaginosis, constant UTIs, these constant things will affect your reproductive system over time. And if you would like to be a mother and give birth easily,
Yes, I like
because it's already a hard thing. It's already hard. It's already difficult. It's a challenge for many of us. You have to be mindful. And you have to maintain your reproductive health. Eating healthy is important. You hear the repetitive information of sugar, 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 sugar. We all ingest a lot of sugar. It's in everything. Everything processed breaks down to sugar. And we're addicted to it. And it's affecting our reproductive systems immensely. So parents, cut back on the sugar with your children. All the smoothies, fruit smoothies, anything red, dark berries, all great. All great. Put it in a smoothie, popsicles, get them used to having this type of thing. And women, a week before your menstrual, it makes it so much easier. The pain, the headaches and things to eat very healthy. You should eat healthy all the time, but if you can't, consider doing it before your menstrual comes, because it will take away a lot of the symptoms, the headaches, the aches, the bloating, all of that stuff. So it has a lot to do with what we eat. So when you go to the doctor and you're complaining, your diet is affecting your menstrual. It is affecting your reproductive system. And it's on you to nourish it properly. It's on us to teach the younger us to nourish it properly and how important it is. It's so important. And if we want longevity in life, we have to nourish our bodies properly. Don't wait like me. First 20 years, I wasn't introduced to much of anything green, fruits and vegetables. What I got at school pretty much was what we got at school. So, all the extra fruits and things like that, the school provided some things, summer school, that summer breakfast and lunch trips with the crew. Absolutely. But at home, it was the basics. We had what we had to survive. So, meeting my husband was a great tool, because he definitely was like, can we get some vegetables? And it took me a minute to adjust to eating that way. But when I got pregnant, my body said, psh, whole switch. My body went on strike with meat, each baby. It disgusted me. And it really made me crave spinach, and healthy things. So I kind of adapted over time more and more, and it took a long time. So I neglected a lot of my body before 20 years old. Had little access. So let's give more access to these healthy foods, because it will affect you later. And we'll discuss later. And less access to men. Absolutely. That is a con in maintaining healthy vagina and reproductive systems, by passing your vagina out to multiple men or women, because mouths are just as nasty as penises if they're not cleaned properly. Okay, so be cautious. And we got another video. Let's go.
I like being manhandled by several different men at once. If you want to call it being ran, you call whatever the fuck you want. I'm sexually liberated and I'm a goddess, and I deserve to have hands all over my body.
Right.
I deserve to be worshipped. Like, why not? I deserve that attention.
Sure. All right. So you.
That type of mentality we should not be encouraging with our young girls. Get a lot of attention from one man. Be able to inspire one man to give you the attention that he could give 1 million women. It's on you. Let's stop that, because we're creating a very unhealthy dynamic in our society with our young girls, that it's okay to be run trains on, because there's people out here who are experiencing it without consent, and it's traumatizing. So, to be parading this type of mentality is horrible. And I would love to see her mother. Shame on her.
Shame. Shame.
I am here to do some good old-fashioned slut shaming.
Yeah! Bring shame back. It's out of control. And now we don't have as much choice as we did before. Your egg gets fertilized. You might have to bring 10 fingers and toes down to the ground and raise that without knowing anything about that other person's family, DNA, character, or nothing. It's been happening, and it's going to continue to happen if we don't give these young people the information that they need, and our young girls to honor their bodies a little more than what they do now. All right, we're going to go into menstruals. So gentlemen, if it might be a little, creepy for you, you don't want to see some things, because we're going to discuss, I got a video about the menstrual colors, and, they're explained.
Red, the color can vary, and sometimes this can confuse you, or sometimes it can just freak you out. Hi ladies, I'm Dr. Simi. In today's video, we'll be talking about the different period blood colors, some of the myths that surround them, and what, if anything, they tell you about your overall health. Okay, so let's start with the first period color, black. So I don't know if this has ever happened to you before, but you go into the toilet and you want to change your pad or your tampon, and then you pull down your knickers, and then sitting there on your pad is like this black blob. Or you might see that there's a black blob clinging on for dear life on the end of your tampon. It can be a bit alarming if you've never seen it before, right? Because you're just like, did that just come out of me? But actually that jelly-like substance that you're seeing is just some old blood that's been hanging around in the vagina, and it's just had a chance to clot, going from a liquid state to a more jelly state. Or it's the lining of your uterus, the endometrium, being shed during your period. You're more likely to see this if you're somebody that suffers from heavy periods, because the endometrium can kind of break away in chunks, and then you can see this. And if you pick it up and then rub it between tissue, you'll realize that it's not actually black at all. It's just a really deep red. It's okay to pick it up. It's coming out of you. It's not disgusting. And you can pick it up and have a look at it closely. Okay, so the other time that you can see black period blood is towards the end of your period, when the blood is taking its time to come out of the vagina, the flow is slower, it's a lighter bleed, and it just means that the blood has a chance to become oxidized and turn black. So let's talk about some of the myths that I've heard about black period blood. So it means that there's a blockage in the vagina. Okay, so black period blood doesn't necessarily indicate that there's a blockage in the vagina. Medical causes of a blockage in the vagina are much more likely to give you an absence of periods or painful periods. The most likely thing that can be blocking the vagina is a forgotten tampon, but a forgotten tampon doesn't change the color of your period blood. It's much more likely to give you a foul smelling vaginal discharge. Black period blood is rarely anything to worry about. But if you notice that the clots are particularly large, or you're starting to feel tired during your period or lethargic, then do speak to your doctor. Brown period blood is just blood that's been oxidized, and you will commonly see this at the beginning or at the end of your period, when the flow is quite light and the blood is taking its time to come out of the vagina, so it's had a chance to combine with oxygen and then become oxidized. It's similar to if you leave a nail outside and then it becomes rusty. The other time that you see this brown period blood is when you first wake up in the morning, because you've spent quite a long period of time lying flat. Then the blood has had a chance to pool in the vagina and to collect, and then when you go to the toilet, you might notice that you have some brown blood. Brown blood can be due to your normal period, due to bleeding after sex because you've got cuts or tiny scrapes from friction in the vagina. It can be due to spotting in between your periods, which has so many other causes. So essentially what I'm saying is that it doesn't tell you anything about the cause of the bleeding. It just tells you that there's a light bleed and that it is slow enough for the blood to have had a chance to be oxidized and turn brown. The other myth that I've been hearing is that this is old blood from your previous month's period. The uterus is like It's like an upside down pear, right? It's smooth, it's got curves, and the vagina is being constantly washed out with vaginal discharge and cervical fluid. In normal anatomy, there isn't anywhere for the blood to go and kind of hide, you know, for a month and then think to itself, oh yeah, I'm going to come out now. The other myth that I've heard is that eating iron-rich food is going to make your period blood darker. Now, even if this were to happen on some molecular level, right, you are unlikely to be able to detect a change in the color of your period blood. For those of you that might get freaked out thinking these specimens are real, they're not. I've literally spent my Saturday evening looking for ingredients to make the perfect period blood. Remember, periods are not disgusting. Okay, so let's move on to a color that you're more familiar with, red. And you will typically see this at the beginning and maybe the middle of your period, and it just means that the blood is coming out at a steady rate, it's not slow, and it hasn't had a chance to be oxidized. I would say that one of the most common myths I see about red blood is that because it's red, it's completely normal. And it's like, yeah, if your period is red, then it's healthy. So it's not that this is a myth, it's just that it can lead you into a false sense of security. The problem with this is that there are other causes of red bleeding that can be mistaken for your period. Bleeding from a cervical polyp can be red. Bleeding in between your periods, which has different causes, can be red. Bleeding after sex, which can be due to an STI, and bleeding from an ectopic pregnancy can all be red. So there are two lessons that I want you to take away here. Not every vaginal bleeding is a period, and bright red bleeding from the vagina doesn't necessarily tell you that the bleeding that you're seeing is normal. So that's why if you have any concerns whatsoever, you should be talking to your doctor. Pink period blood can happen if the flow is really light. So for example, at the beginning of your period, and it just means that the blood is being diluted by vaginal discharge or cervical fluid. So some of the myths that I've seen about pink period blood. So pink period blood means that you are low in estrogen. Being low in estrogen is much more likely to cause your period to stop or become erratic than to change the color of the period to being pink. Also, having high estrogen, such as when you are on the combined oral contraceptive pill, can actually make your flow lighter, which means that the blood can come out looking pink because it's diluted or dark because it's oxidized. So essentially what I'm saying is that your period blood can be pink whether you have low estrogen, high estrogen, or normal estrogen. Okay, so this is another myth. Period blood can be purple. Human blood is typically red, and that's because of the heme component of the hemoglobin in the red blood cells. Also, another myth that I've seen is that period blood can be grey. You shouldn't be having grey period blood. You can, however, have grey vaginal discharge, which can sometimes be a sign of bacterial vaginosis. And if you want to know more about that, then you can watch my video on vaginal discharge colours. Okay, so another myth that I see is that watery period blood means that you're anemic. Actually, in anemia, the colour of the period doesn't change. If you have watery looking period blood, it's much more likely to be because it's been diluted by vaginal discharge or cervical fluids. So one of the biggest myths that I also hear is that the colour of your period tells you something about your overall health. The colour can't tell you anything about your overall health because it can mean so many different things. It's the flow rate, the exposure to oxygen, and whether that blood has been diluted that's going to determine the colour of your period blood. If the flow rate is quick, then the blood will exit the vagina quicker and you will see this as bright red. If the flow rate is slower, then it will have more of a chance to combine with oxygen and to be oxidized, and you will see it as either dark red, a brown, or sometimes black. If it's diluted by cervical fluid or vaginal discharge, then it may come out pink. You can see that most of the period blood colours can be normal, but that doesn't mean that you should diagnose yourself. If you've got any concerns about your periods, please see your doctor irrespective of the colour. Also, please see your doctor if you have irregular, painful or heavy periods, bleeding in between your periods, after sex or after menopause, and also any sort of bleeding during pregnancy. Thank you for watching. If you found this helpful, please do share it.
That was a lot of information. A lot of information. A lot of myths. You hear all the myths? What you eat. It just tells me you have to be mindful. You have to be mindful about what's going on and what's coming out of your body. Because when you do go to the doctor, they ask, and it can't be, I don't know, when was your last period? You know, how has the flow been? How heavy, light? They need to know these things in order to make a proper diagnosis, especially if you're starting to have trouble. At least a year of awareness to reflect on so you can be able to share with your doctors, because they can only assume. They can make a whole bunch of assumptions. I mean, it costs a lot. Have a lot of them scans, ultrasounds. So I hope that has, helped someone to understand the different colorations of, your menstrual cycle. And when your young child is coming on, it's a great tool to share with them as well, so they're aware and it's not scary. I think we used to say when it was light pink on you, it's when sex was happening. When it's light pink on your pad, you might be pregnant. Okay. So, a lot of the misinformation, it messes us up. We're not able to make the proper choices. And many of us wait way too long. By the time many of us get to the proper gynecologist, it might be too far gone. So it's best to, make sure they're aware and they're comfortable enough to advocate for themselves. And it's not pushed for us to pay that much attention. Again, we are raising 3 females. So just to, be a regular, visit to their care physicians. And, as they were getting older, me asking, how early is too early for them to have, pap smears and such. So they simply said, as long as they're not sexually active, it's not needed. Okay. So what if they're not sexually active till they're 25 years old? Like, how do you, I would dig a little more. So if you just felt any concerns, if you had any pain or, so again, you have to pay attention to your body and, if flags are risen, keep a data notes. There's so many apps you can have on your phone as far as your health, so you can keep record, just so you have that information. Because these kids can get to 25, 26, and they're ready to start a family, or even 30. And they neglected to, get any real information about their fertility and, if it's healthy enough for them to, do this and make this plan. And that's when you find out being reactive. It winds up being reactive instead of being proactive. So 2023, let's try to promote that. Let's get in the mindset of teaching our young girls and boys as well. They can watch this because you guys need this information as well. You can't be clueless of what happens to females' bodies and, expect us to just think, because a lot of you gentlemen don't know. And if a lot of you gentlemen are out here single fathers or even in your children's life and they're comfortable enough more to come to you than mommy, you're able to guide them through this because it's very important. It's very important. We need to cherish our bodies and treat them like the awesome vessels that they are. Hey, Sir Hale, how are you doing? Paris Dunbar is in the building. Sir Hale is in the building. Happy Sunday, Shame Sunday. Been discussing the epidemic of stinky cats running around. So I'm trying to give some much needed information about what's happening. And we're going to come into what traumas exist for us. So I do have some videos about that as well. Hopefully you guys are getting some information out of this. And I think we're going to move on to the next video. Let's see what I got. So there's a way to, there's ways to find out about your fertility, which is something that you guys should know. Share with your young girls, because it's important.
There are a variety of diagnostic tests done specifically on women to try to determine the cause for low fertility or infertility. One of the first things that we do is check what we call an ovarian reserve number. What ovarian reserve is a description of a woman's chances of conceiving with her current egg supply. Women lose eggs as they get older, and the quality of those eggs tends to diminish as well. As a result, we do certain blood tests and ultrasound examinations to assess a woman's ovarian reserve. That is, essentially, look at the quantity and quality of her eggs. We do certain tests including a follicle-stimulating hormone level in the early part of the cycle. We also look at another hormone called anti-Mullerian hormone, or AMH. That also gives us an indication of egg quality and number. And we also can do what's called an antral follicle count, where we actually use an ultrasound to determine the number of follicles in a woman's ovaries. Women with lots of follicles tend to have a much higher chance of conceiving successfully than those who have a very low number of follicles. Follicle numbers decrease as women age. In addition to these tests, we also will check a woman's fallopian tubes. We do a test called a hysterosalpingogram, also known as an HSG. It's an X-ray test in which dye is placed through the cervix into the uterine cavity and is then seen by X-ray moving up the fallopian tubes towards the end of the tubes. Women with open tubes will have what's called free spill. The dye will spill from the ends of the fallopian tubes, showing open or patent fallopian tubes. Blockages or stoppage of the dye can be seen by X-ray as well, indicating an occlusion of one or both fallopian tubes. In addition, we do ovulation testing, either by blood tests or by ultrasound, and we can therefore time and also ascertain whether a woman is in fact ovulating. We also will do a test of the uterine cavity to determine if there's any abnormalities. To do that, we often do what's called a saline hysterosonogram. And in that test, saline solution is placed through the cervix into the uterine cavity, and by ultrasound, we can then determine if there are polyps or fibroids or any other abnormalities of the uterus. There are additional tests done as well, but they're far less common and far less useful. There are multiple diagnostic tests that are required. It's very difficult sometimes to get these tests done in a very short time span because some of them are cycle related. For example, the blood tests have to be done early in the cycle and other tests at later times of the cycle. These are some of the fertility tests that are being done on women. Speak to your reproductive endocrinologist about which tests are right for you.
Yep, endocrinologist. It's a lot of different doctors out there. But when people go get tested, they're being reactive. It's a reactive because it hasn't been happening. I heard him say it more than one time that as you age, your eggs age. So scientifically, the younger, the better. And that's simply because it's just a safer, healthier chance. Because we're all not capable. Do you hear that? It can always be something. Your tube, your ovaries, your uterus. And being aware of this information is important for our young girls. I think now we're just teaching them to have WAP. Like that's important. They have no idea how important their wombs are, their vaginas are, the eggs that are there, mishandling their bodies, their minds. Yes, okay. Thank you. I want to appreciate Harris Tribe Media Group for dropping the Cash App. Shout out to you. Always appreciate it.
Get them black. Get them black. Get them black. Get them black. Money. Fuck them up. I play. Get them right. Tighten up. Get right. Get them black. Tighten up. Fuck them up. Get them right. Tighten up.
You know my sales slogan. You want it, I got it. If I ain't got it, I'm gonna get it. So get it while the getting's good.
Shout out to you. Thank you. Thank you. Much appreciated. So I hope the doctor gave you guys some information, about some testing that can be done to be proactive, to ensure that, your eggs, your womb is all healthy. If you choose and decide to wait to have children, it's definitely something that you should promote. If you're encouraging your young girls to wait, get that education, get to the doctor. If you plan to want to have children, that's something that you desire. It's your responsibility to make sure that your eggs are viable, your womb is healthy, your uterus can handle it. Be proactive because it is your body and your choice. Shout out to Mr. He Said. Ladies rarely discuss the realistic numbers when it comes to the number of eggs that they have and the quality of them. It's not even something that they're aware. You're stuck with whatever eggs you got. And if they are not viable, they're not viable. It's nothing that can change that. It's a lot of, other scientific methods that they have now, but yours, they won't be viable. So it's something that we need to know young, especially if we're choosing career over children and then desire a family and children later. So it's your responsibility. And simple tests. You go in, have some tests, and make sure that that's going to happen for you. But there's a lot of problems that can cause you to be infertile. So the next couple of videos is pretty much going to touch on some information about endometriosis, ovarian cancer, PCOS. There's so many disorders that women should be aware of, young girls should be aware of, to know, to question, to at least, have some idea when they go into a gynecologist and, to find out what's happening.
As endometriosis progresses, it's important to find a team that can solve it properly, just like the one here at Florida Hospital Celebration Health. The cause of endometriosis is unknown, but we know why it causes pain. Basically, the outside of your uterus acts like the inside of it. It thickens and breaks down during your menstrual cycle. But since it has nowhere to go, the tissue becomes irritated and the patient experiences pain. With moderate to severe endometriosis, these inflamed areas become fibrotic and scar-like. They develop their own blood supply, which allows them to grow and spread. At this more developed stage, endometriosis actually begins to distort the anatomy. The function of the ovaries and the fallopian tubes can be compromised, making it difficult for a woman to become pregnant. When found early enough, we can treat endometriosis with medications, but at the moderate and severe stages, we solve it with surgery. The good news is, we specialize in this exact type of surgery at Celebration Health. We're unique in that we have a multi-specialty team, a general surgeon, a urologist, and gynecologist, all working together to recreate the normal anatomy. It's something not found at many other hospitals. With minimally invasive surgery, we can remove the abnormal tissue. This technique has a short recovery time, getting our patients back on their feet quickly. In fact, other surgeons from around the world come here to learn the surgical techniques we've developed in treating endometriosis. We're also teaching doctors how to recognize the disease sooner. On average, it takes a woman 9 years to find out she has endometriosis. But because of our experience, specialty, and streamlined care, we recognize and treat it much sooner. Giving women the ability to go about their lives, to have kids, to enjoy intimacy, and to live free of pain.
Yeah. Endometriosis. If you haven't seen the recent commercials over the last couple of years, it's a silent one. So this one is a silent one. It's more of doctors eliminating everything else to decide to go in and see if this is it, because it's not something seen on scans, no blood work, no sonograms, vaginal ultrasounds, none of that. Was able to see it, x-rays, MRI, nothing. I had a dermoid cyst and fallopian tube on the left side needed to come out, and I had surgery 2017 in November, and that's when I found out I had endometriosis. So who knows how long I had it, but just years of pain, complaints, things I got through it, so it wasn't that bad where I was going to the doctor. And I think that's a problem for a lot of us women. I'm good. What's your pain level? Oh, right now it's 4, but when I'm in pain, I'm killed over and ready to go to the ER. So, sometimes we really need to be more vulnerable, open and honest, and, more self-reflecting. So we can be able to, devolve this information to the doctors, because they need to know, because this disease is all about eliminating. So, if you don't have any other problems and they eliminate those things, then they would say, okay, now we need to plan a laparoscopy to go in and have a look. And if we go in and have a look and it's there, we'll scrape it away, we'll clean it all out, and then of course, you're going to have to keep reevaluating to see how long it takes for it to come back or whatever the case may be. So it's not a lot of study. They're pretty much getting their hands in now, studying it. But as far as I know, there's no testing because I've been battling with endometriosis, who knows how long, but 2017 was when I was diagnosed and still been battling. And into February, I will be having surgery again and get it all out. Full hysterectomy. I'm ready. I'm prepared. And at the end of this show, I'm going to put a little video up so you guys can see, how they do that, what's going to happen, recovery and such, just so, you guys be aware of what's happening to your body so you can be proactive and, make sure you have a good support system. Yes. So I'm not just talking about it, living through it. A survivor of the little black monster. Oh man, what it is to be a woman. What a great thing. Let me tell you.
Smelly cat, what are they feeding you? Everybody! Smelly cat, it's not your fault.
Oh man. Yeah, you gotta have a little fun before we get back in. Just a little bit.
When I do your hair.
I don't want to be right here and stink.
What stink? You trying to say I stink?
Yes, ma'am.
Ren, I'm about to go bathe in a minute. You ain't gonna smell me too long, baby. I'm finna finish your hair. I ain't that bad now. Come on now. You ain't have to do me like that now, Rennie. You ain't have to do me like that. I'm gonna smell you and change you and pepper and all that stuff. You ain't got to do me like that. I know, I know I'm right, but it ain't that bad down now. You just did me wrong now. You did me wrong, but you got that. You did me wrong. You could have been told me if you smell something. You could have been told me you smell something. But we almost done now. You don't let me go this long doing your hair.
We teach our children to not be honest.
Shame.
Come on. Don't let no babies sit between your legs. You got to do their hair. Come on. And the shame and the insults you want to throw back at the baby for being honest. When my head was the other way, I didn't smell it. But now that I'm turned this way, it's a bit much, grandma or auntie or whoever. And a lot of women take it like that. When you tell a woman she stink, it's a problem. Because, had to tell a man they stink. Yo, go take care of that. All right, you need me to go clean that up. Yeah. It's not a problem. We are so offended. And you should be. Take care of that. Should not be funky. It's an epidemic.
Smell like grandpa fish, but
Stop disrespecting these kids' nostrils, thinking that they not supposed to be outspoken and tell you that you funky. Stop placing them in between your legs to comb their hair and you ain't even washed your ass. You telling them to brush their teeth and wash their face so they don't greet you with no funky ass breath and they disrespect your nostrils. How the fuck you gonna tell them to do some shit like that as if your ass don't stink? That baby had to tell you smell like fresh seafood or gefilte fish in order for you to get mad at her because your ass stink. Get you a rag, some soap, a loofah, body soap. Wash your ass and quit disrespecting that baby nose. They got fucking feelings too. And you smell your ass first. Should be a fucking shame to yourself.
Thank you, sis. It's not just me then. When I say it, I seem a little harsh, but whatever. It's true. Stop making these babies lie. Take care of yourself. You know you smell. I mean, it's to some degree, some people don't know that they smell. But sometimes their whole house smell like that and they car. But somebody tell you, you get all offended. Whatever.
Stephanie said you mad. That's what she said.
No, I'm not.
Oh, did she walk away and the baby said she smelled like fish?
Smelly cat, what?
Shame. It's amazing. But what we want to do with the attention, she got the phone set up, about to do some TikToks. The baby's is right there. The house is dirty, trash bags sitting in the back, weave all the way down her backs, and with stink crotch. Come on, y'all. Come on. We cannot be wanting that much attention. But then when I say it, I seem harsh. Or we're not talking about everybody. Well, a large percentage of us ladies running around here with stinky vagina. The lesbians is about to stop being lesbians because y'all crotch is not up to date. And it's you pretty ones all on the Instagram with the clack and the but your vagina smells bad. What say you?
You can't make this shit up.
I don't even want to be gay no more. Like, I done been scarred so bad by stanky cats that it just ain't worth it. Like, you see them on the social media and you be like, damn, they fine. Then when they take their clothes off of you, you be like, damn, they stink. Gosh, where this fine ass bitch that was on social media that I thought smelled good? You look like you smell good, but you don't smell good. Y'all out here catfishing.
They out here catfishing, she said. Whew. Man. Yeah, no, it can't be a coincidence. We have all these videos. Come on now. Everybody's saying it. The men, the women, the children is saying it. Listen, this is a PSA. Mothers, aunties, have these conversations. Shame on us. We need to do better with prepping our young girls. It is not okay for us to be coming out into society or sitting at home with funky bodies. You got to take care of yourself. It's very important. And then when somebody tells you, someone that you're intimate with, that you don't smell good, I don't care how it's delivered, how the tone is, how dare you present yourself to them with the ranchedness of funk. Shame on you. I would be shamed. Boo. I'll even say, listen, go wash up real quick. And it ain't even got to be funky. There's nothing wrong with that. Just presenting fish on a platter.
Shame. Shame.
Got the men running. And something may be going on. So I need to take care of that.
Jesus Christ.
We're teaching them real good how to do TikToks. Teaching them real good how to, put all this wigs and makeup on their face. We're teaching them real good how to keep these skin tight clothes on and the little belly shirts and stuff. We teaching them real good. I'm a homeschool educator now, so just to find out the kids out here are really not learning anything. Literacy wise, mathematics wise, it's a small percentage who are progressing at a good rate. But a lot of our youth are misguided, and it's a lot our fault. Their vessel is very important. They only have one. It's only one. You only get one body. But y'all looking at society, and society say, nah, you don't like them boobs? You can get you some more. You don't like that butt? You can get you some more. Gentlemen, your penis too small? You can enlarge it. Matter of fact, you want to change your whole gender identity? You can do that too. It's a new world. But they still need to know how their body works, and wait until the 7th grade to get a damn class on how your body works is stupidity. It's tragic. So it's our job. We handing our children over to the system, to technology so freely. And they're going to be adults one day, selfish, little inconsiderate, self-absorbed, entitled little people. Big people, and you think they're going to come back and take care of you? I don't know. It's no guarantee. So we're not teaching them to honor their parents, honor their home, honor their bodies, honor their wombs and their seeds. Gentlemen, this goes for everybody. It's disrespectful to nature. Rewind back to ovulation and fertilization and see how magical and amazing it is to just waste it on anybody. Put yourself in a predicament to be fertilized by someone you don't know, and then force them in it. Force yourself in it. How are these children going to turn out? Be intentional with your life. Be intentional with your womb. It's important. Broke that ice. Only got a couple little more. So I got a video of the process of having a hysterectomy. It's a real short video. They show you, the anatomy of it. Let's have a look.
If you are a female and have certain problems with your reproductive organs, your doctor may recommend a robotic hysterectomy to remove your uterus. Your reproductive organs include your vagina, cervix, uterus, fallopian tubes, and ovaries. You may need a robotic hysterectomy if you have one of the following diseases or conditions: heavy or constant uterine bleeding, anemia, and pelvic pain, cancer in your uterus, cervix or ovaries, non-cancerous fibroid tumors in your uterus, or slipping and sagging of your uterus into your vagina due to weak or injured pelvic muscles and uterine ligaments. Before your procedure, an intravenous line, or IV, will be started. You may be given antibiotics through the IV to decrease your chance of infection. You'll be given general anesthesia. A breathing tube will be inserted through your mouth and down your throat to help you breathe during the operation. Your surgeon will make a small incision near your belly button and insert a plastic tube called a port. Carbon dioxide gas will be pumped into your abdomen through this port. The gas will inflate your abdomen, giving your surgeon more room to see and move the surgical tools. After your abdomen is inflated, a high-definition camera will be inserted into this port. Your surgeon will make additional port incisions for robotic instruments as well as instruments used by patient-side assistants. An assistant will insert all of the robotic tools through these ports. Unlike standard laparoscopic instruments, these tools can rotate 360 degrees and have more flexibility than the human wrist. Seated at a special console, your surgeon will operate the robotic arms and the camera with joystick-like controls and foot pedals. A computer will translate the exact movements of your surgeon's fingers into precise movements of the surgical tools. At the same time, a high-definition vision system will provide a magnified three-dimensional stereoscopic view of the surgical area. Depending on your condition, you may have a partial hysterectomy, in which your surgeon will remove your uterus but leave your cervix, fallopian tubes, and ovaries in place. If you have a total hysterectomy, your surgeon will remove your cervix along with your uterus. If you have a radical hysterectomy, your surgeon may also remove your fallopian tubes, ovaries, the upper part of your vagina, as well as nearby tissue such as your pelvic lymph nodes. At the end of your procedure, the tiny incisions will be closed with stitches, staples, surgical glue, or closure tape dressings. After your procedure, your breathing tube will be removed, and you will be taken to the recovery area for monitoring. You will be given pain medication as needed. You may continue to receive antibiotics through your IV. You may be released from the hospital the same day or within 1 day after the procedure.
Seems simple, but I'm sure it's not. Could you imagine you see technology now? There was a time they would have to slit the woman's whole midsection and go in that way. So I don't even think women realize, or maybe I might be wrong, that your ovaries sit in your back. They're not even right up front in your abdomen. They kind of more sit toward your back. Just so you know, those tight ache pains back there. Yeah, it feels like it's your stomach, but it's not. Many of us don't even know where our organs sit in our body. You know, it's important. It's your body. It's one thing you should know. All right. This is a healthy womb. This is what a healthy, the anatomy of us looks like. Ovaries healthy, fallopian tubes, everything's clear. This is vagina, vulvas. They all are different. Penises are all different. You know, not one is alike. There's many different variations to it. You know, and it changes over time, of course. You have children, more children, things look a little different. But they look different. So even for the young boys, it's okay to have them sit down and get this reproductive information. You know, so they're aware. They won't know vagina till they see one up close and personal, right? So, and these are the parts. The top, you have the mons pubis, the clitoris hood. So a clitoris is similar to an uncircumcised penis. It's just very tiny. The clitoris is on the inside, and the clitoris hood is a sleeve that covers it. And young girls are not taught that that exists. So when they go to clean themselves, they're not pulling that sleeve back like an uncircumcised penis would. Pull it back to clean whatever can be in there, you know, tissue, cotton particles from your panties and such, because it can get caught in there. And, you know, something caught in there too long, of course, it's going to give you an infection. It's going to start to cause some itching and problems. And, you know, that's where the clitoris is. Can you see it? It's at the top, right above the pubic hair, and it kind of looks like a small uncircumcised penis. Okay, and it can get hard and grow in size as it's stimulated. So it's important to know these things. The outside layers of the vagina is called the labia majora. So it's the thicker cushion of the vagina. And the inside portion would be the labia minora. It's a thinner. That's the picture before with the pink. Yeah, that's kind of what you see on the inside. And the inside of that, it's the vestibule. It's the urethra and the vagina openings. And the portion from the end of the vagina to before the anus hole is called the fasciata. So these are the parts of the vagina. And of course, the bottom hole is the anus. And this is the anatomy of what the vagina looks like when it's spread eagle. All right, pelvic exams for women. This is a pelvic exam. You know, so for people who have never had. You have some young folk who have never been to get an exam. The doctor will be administering this exam to check on your cervix, your ovaries. They can feel from doing this, as well as your bladder, and they can even feel the back of your anus canal. So it's a lot of things that they look for when they are doing this exam, the size of your ovaries on each side, and the tenderness. Because of course, if they squeeze it, you know, if you feel something or whatever, they can decide whether to look further or deeper, you know, to get an exam. That's how it looks when they're in there. All right. So there's stages of ovarian cancer. Like I said, in this country, many women are not finding out until they're way into stage 4. So, you know, stage 1, the cancer is confined to the ovaries. You will have problems, of course. So it's good to, you know, talk to your doctor and have exams if you know, symptoms are bad. You know, don't wait. Stage 2 is in one or both ovaries, and it starts to spread to the pelvic region. So it starts to spread. Stage 3 is in one or both ovaries, and it has either spread to the lining of the abdomen or to the lymph nodes to the back of the abdomen. And stage 4, the cancer has metastasized. Now this can happen, it can attach itself to distant sites of the organs outside the abdomen and the pelvic region. So, you know, this kills many of us. This is one of the highest stages of death for women, ovarian cancer. What does that say? Please tell women 3 things. 1, most ovarian cancers start in the fallopian tubes. 2, consider having your fallopian tubes removed when undergoing hysterectomy or tubal ligation, especially if it's in your tubes. Get them out. Don't wait. It grows quickly. Stage 3 things. The 3rd thing, all women who have been diagnosed with ovarian cancer should request genetic hereditary testing. Nobody has ever told me that. And I've been going to obstetrics and gynecologists since I was 14, 15 years old. And never once has it been suggested for me to do that type of testing. So ask. If you don't ask, they don't tell. It's amazing. What is PCOS? This is another traumatizing disease that women can come across. It affects 1 in 10 women. 1 in 10 women. Let me get the full screen. Thank you. Polycystic ovarian syndrome. It is a serious genetic, hormone, metabolic, and reproductive disorder that affects women. It is the leading cause of female infertility. PCOS can lead to lifelong complications and other serious conditions, including severe anxiety and depression, obesity, endometrial cancer, type 2 diabetes, liver disease, and cardiovascular disease. 50% of women with PCOS go underdiagnosed. No diagnosing. Nobody's going to the doctor. 50%. That is 50% of women infertile. It's a lot. So we really need to be aware of all these things that are possible. 50% of women with PCOS who will develop type 2 diabetes or pre-diabetic before the age of 40. So, you know, your reproductive system can affect a lot of many other things if it's not healthy. 13.8 billion estimated annual costs to American healthcare system to diagnose and treat women with PCOS. It's a lot of money. It's a lot of money. And we need to start with taking care of ourselves and eating properly. 3 times the increased risk of women with PCOS develop endometrial cancer. There are some common signs and symptoms to PCOS. Let's look at those. Right under it. Irregular periods, excess facial and body hair. Pay attention to your body. Severe acne, small cysts in ovaries, insulin resistance, anxiety and depression, infertility, weight gain, male pattern hair loss. Pay attention to the signs. This is what it would look like, an unhealthy anatomy, reproductive system. So PCOS healing. Again, we have to support healthy eating, exercise and losing weight, eliminating sugar, keeping your blood sugar under control, eliminating toxins, anti-inflammatory treatments, taking vitamins, lessen stress, so many things that we can do for self, to make sure we're feeling good and feeling healthy. Endometriosis. It's just a little information about the endo. When the tissue lining in the inside of the uterus grows outside the uterus, it can cause chronic pain, internal bleeding, infertility, fatigue, and bowel or urinary problems. About 5 million women in the US have this condition, with a quarter of those experiencing no symptoms. That's why I say it takes up to 9 years for a woman to find out she has endometriosis. It just sits there until it grows fast and you feel pain, so you have to be conscious. And this is what it looks like. It can be anywhere. And this is a bad one because it can travel to other organs, anything near, connect to your colon, all of it. So, it's something that you have to be serious about and proactive. Once you find out. That's why I'm having a full hysterectomy. It got to go. And just going into, again, another conversation that we do not have, talking about the stages of menopause, the fluctuating of hormones, the difference between premenopause, perimenopause, and then going into full-blown menopause. And then there's postmenopause. It's a lot that goes on with us ladies, girls, gentlemen. And our hormones control a lot. Some of us may be able to keep a lot of that control managed, but the more you know, the better you can do. So just knowing when it happens, you can feel it. If you listen well, you can feel it. But there's ages of when it starts to happen. So premenopause can begin, anywhere from 0 to 35. Perimenopause from 45 to 50. Menopause usually for women, early 50s to mid 50s to 60, and that's ranges from all women. It's different for all of us. So, I think hereditarily we can probably monitor that with our elders. Usually that kind of flows the same. If grandma went into menopause at 58, her child, and so on and so on. So, getting that family history is very important. You're not in menopause until you haven't had a period for 12 months consistently. Okay, but there's a whole buildup. There's at least 10 years before that where you have all the horrible fluctuations of your hormones, irritability, cramps, insomnia, irregular periods, night sweats, hot flashes, loss of libido, weight gain uncontrollably, and then it starts to go sideways once menopause. It's a lot of things that happen with your body, your vagina, and your breasts, and so, we need to be more conscious and more educating to our younger people, because it's important and they're going to need to know, because all of us may not be here. We may not be here to give it to them. And for them to have to react to trauma, it's going to be something to handle. So we just want to be proactive, give you some information. And it's so many symptoms. It's 34 symptoms of menopause. So again, paying attention to your body, knowing what's happening, keeping a journal at times, because when you do go in to talk to the doctor, they need this. They need specifics in order to help you. So, you're going in acting a fool and crying, carrying on, and you can't give them no concrete information. It's going to be hard to diagnose. So as you can see, it's a lot. Tingling extremities, electric sensations, hot flashes, night sweats, vaginal dryness, decreased sex drive, breast soreness, irregular periods, bloating, headaches, mood swings, fatigue, depression, anxiety, irritability, panic disorder, joint pain, dizziness, incontinence, brittle nails, concentration lapse, memory lapse, weight gain, irregular heartbeat, osteoporosis, thinning hair, disruptive sleep, muscle aches, digestive changes, burning mouth, It's a lot. That's a lot of symptoms. But you got to pay attention to it. Keep note, keep a journal. It's important if you seek help. And this is just a list, take note of these hormones. When you go in, you can ask for a hormonal panel to see where you may lie. FSH levels, your follicle stimulating hormone levels. It's important. Again, if you don't ask, they don't tell. Try to advocate for you because they will not give you the information that you need to make better choices. This is what we need to eat, ladies. This is what's best for our body and our reproductive system. I know it's hard to believe, but it's absolutely true. Even with the GMOs, I'm just going to have to pick up stuff because I don't know what's real and what's not. But I'm going to take a chance with this versus, all the processed food because, my body is telling me I need it. So I hope you guys out there listening because this is important. That's what a healthy diet looks like. Of course, fish, small portions of meat and such, potatoes and pasta and rice. Okay. Nobody's saying just eat all of that, but that's what's important for your reproductive system. All of those berries and fruits and greens. That's what we need for our eggs to flourish because they are sitting in there from the time that we are in our parents' womb, in our mother's womb. You're set. You're set with what you got. There's no revitalizing them, none of that. So to be mindful that you have to nurture them before you even consider having any children is important. So feeding your body what it needs is going to, create a better opportunity and a better chance for you to wait as long as you want. So if you know early, it gives you a better purpose to make good decisions. The last video I had was pretty much, that was just after surgery. Yeah, that's it. Just talking, what you should do, the do's and don'ts of having a surgery like this. Just give.
Thousands of Canadians undergo surgery, and the process, including the effects of anesthesia, can take a toll on your body in many ways, says registered dietitian Lori Halton.
Some of the general side effects of surgery are constipation, fatigue, loss of appetite, nausea and vomiting.
To combat constipation, get plenty of fluids and reach for fiber-rich foods like fresh fruits, vegetables, and whole grains. Halton says adding protein to every meal and snack, things like meat, eggs, and beans, will help heal wounds, build energy, and keep your immune system strong. For nausea and vomiting, Halton recommends bland foods and small, frequent meals instead of 3 big ones. Peppermint and ginger in forms like candies and teas may also help alleviate symptoms. Depending on what type of surgery you've had, your doctor may recommend easing back to eating progressively, starting with clear fluids and moving back towards your regular diet over time.
People who don't have an appetite or their appetite has been reduced for a while, a dietitian may suggest a nutritional supplement such as Boost or Ensure that would have the protein and have the calories that would help to, alleviate fatigue and help the body with healing and give you energy.
Eating well can also contribute to the healing process after surgery. Choose whole grains, lean meat, and fish such as salmon for omega-3s and oils, and avocado. Choosing healthy whole foods and less sugar, alcohol, and processed foods is key, says Halton. But if you're really craving some comfort food, a pot of chicken soup is always a safe bet.
Smelly cat, what are they feeding you? Everybody! Smelly cat, it's not your fault.
Now you're being condescending. See, you've been warned, all right? Let's move forward amicably.
Okay, well, check this out, though. First of all, you're throwing too many big words at me. Okay, now, because I don't understand them, I'm going to take them as disrespect. Watch your mouth and help me with the sale.
Okay, see? See, now you found yourself a nigga. You was looking for a nigga? Nigga here now, see?
Okay.
I'm back. Oh, man. Hope we got some knowledge and some information out of today's show. I appreciate y'all. And I hope you share with anyone you think may need it. It'll be here for you guys to watch, rewind if you need to. Hopefully I was tamed on my foul mouth a little bit so you can show it to the young folk. I'm sure they hear it, but I think this is a good idea, so on top of bringing shame back, there's going to be some tools and some reflecting and some solutions to what I'm seeing, because we got to do a better job out here teaching, being the models. Can't just teach it, you have to model it. So it's been a great Sunday. I wish everybody well. Let's do great in 2023. Let's be adults and mentors, and mentor as many as we possibly can. Try to turn it around. It's going to take some time, but we here, and I'm here to build with anybody. So you guys holler. I appreciate everybody who popped in and came to check a sister out today on Shame Sunday. Again, Queen Karma was in the house. I appreciate you, sis. The E-Man was here. Sir Hale. Shout out to Lady Hale. Hope you're doing well, sis. Paris was in the building. I appreciate you. All right. Of course, Mr. He said always holding it good. So, all right. Yep. So shout out to the mothers who are constantly giving that knowledge to their young folk, because they're going to need it. Schools are crap. System is crap. Libraries are crap. And the idiot box is crap. They have to look for it. And as we know, they're not looking for the stuff that's going to give them some nourishment. It's too much other easily influenced things to take their attention. And we got many attention whores out here, and it's not just girls. So, let's get it together, be a little bit more disciplined, especially with our health. Be proactive and, drink water. Always ended on that. Drink some water. Shit, come a day we ain't got none. You're going to be looking back at all of what you wasted. I'm just saying. All right. All right, Mr. He said, taking us home. Get some dinner. Happy Sunday.
Everything in creation and in physical form has its own fundamental resonant frequencies.